You can just walk right into a store and buy them without a prescription. They're sitting right there on the shelf, literally right next to your daily vitamins and your toothpaste. Chances are you've probably taken one today, or maybe this week, or at least at some point in the last month for a pounding headache, an aching knee, or just to power through a busy afternoon. And because they're totally over the counter, we automatically assume they're safe by definition. But are they really?
Welcome to today's Explainer. We are going to completely dismantle this myth of absolute safety when it comes to over-the-counter painkillers, especially for our aging kidneys. We're going to look closely at 3 extremely common medications that might be doing some completely invisible damage to your body's most critical filtration system. And most importantly, we'll talk about how you can actually protect yourself.
Okay, let's dive right into this. Here is our roadmap for today. First up, the silent kidney threat, followed by ibuprofen's flow and naproxen's burden. Then we'll uncover the triple whammy danger, acetaminophen's limits, and finally, how to protect your filters.
Section 1. The silent kidney threat.
So, as we age, the margin of error our kidneys have to absorb stress becomes dangerously thin. I mean, the exact same dose that was completely safe at 40, it might function entirely differently in your body at 70. To actually measure this, doctors use something called eGFR, or estimated glomerular filtration rate. Now, your kidneys rely heavily on adequate blood flow, and eGFR is basically the baseline measure of how efficiently they process that blood. Honestly, it's the absolute most important number you can know when it comes to your kidney health.
And here is the magic number you really need to remember: 60. An eGFR above 90, that's considered perfectly normal. But once that number drops below 60, it indicates moderate impairment. Now, don't panic. That doesn't necessarily mean absolute failure, but it absolutely means your kidney's reserve capacity is significantly thinner. Dropping below 60 is exactly where nephrology guidelines recommend some serious caution or even complete avoidance of certain pain medications.
Moving on to Section 2, ibuprofen's flow.
So this category includes those super popular brand names you definitely know, like Advil and Motrin, which are known as NSAIDs. For acute pain, sure, they're generally well tolerated, but let's look at the actual biological mechanics of regular use. Normally, these molecules, called prostaglandins, maintain the dilation of your blood vessels, which keeps the blood flowing nice and easily to the kidneys. While ibuprofen reduces your pain by inhibiting those exact prostaglandins. But here's the catch: that also forces your kidneys' blood vessels to constrict. Think of it exactly like a garden hose with someone standing right on it. The pressure starts building up dramatically behind that restriction. In your kidney, that sustained pressure chronically stresses your very delicate filtration tissue.
And this right here brilliantly illustrates the real-world consequences of all that pressure. Look at these risk increases for chronic kidney disease associated with NSAID use. A massive meta-analysis found a 24% overall risk increase, but for seniors in a 10-year study, it was 46%. And what if you already have some prior kidney impairment? That risk jumps by a whopping 67%. It's a highly dose-dependent risk. Actually, it's pretty shocking. A study in Sweden found that 42% of seniors buying ibuprofen over the counter already had an eGFR below 60. And the crazy part? They had absolutely no way of knowing it because the packaging requires 0 kidney function warnings. None.
Let's look at Section 3, naproxen's 12-hour burden.
Now, naproxen, which is commonly known as Aleve, is also an NSAID, so it operates on that exact same constricting mechanism we just talked about. But here, the stakes are actually a lot higher, mostly because of its timeline. See, ibuprofen has a half-life of roughly 4 to 6 hours, while naproxen has a half-life of approximately 12 hours. It's brilliantly marketed as lasting up to 12 hours, right? Just pop one pill in the morning and you're covered for the whole entire day. And hey, that sounds totally great for something like arthritis pain, but for your aging kidneys, that 12-hour window means they get literally 0 recovery period between doses. Following a standard regimen means your kidneys are under continuous, unrelenting suppression, straight around the clock.
All right, Section 4, the triple whammy danger. This brings us to a very real, documented clinical phenomenon that affects countless people over 60 who are just trying to manage their blood pressure. The clinical term is the triple whammy, and it refers to the precise combination of 3 drug categories taken together: ACE inhibitors or ARBs, diuretics, and over-the-counter NSAIDs. Let's systematically break down this mechanical disaster, okay? So ACE inhibitors dilate the outflow of the kidney. Diuretics lower your overall fluid volume, and NSAIDs, as we just learned, constrict the inflow.
So, the result of all that? The kidney is left completely without its normal compensatory tools. It entirely loses its ability to regulate pressure. It's totally defenseless. A massive study of 500,000 patients linked this exact triple combination to acute kidney injury, noting that the risk was particularly elevated in the first 30 days of using the combo. And this happens constantly. Often, it's simply because the doctor prescribing the blood pressure meds has absolutely no idea the patient is taking an over-the-counter NSAID for their aching knee.
Let's move to Section 5, acetaminophen's hidden limits. Now, you might be wondering, well, what's the alternative then? Interestingly, the National Kidney Foundation actually recommends acetaminophen as the preferred pain reliever because, unlike NSAIDs, it doesn't cause that vascular constriction. But it does have a very specific hidden trap. Acetaminophen is processed primarily by the liver. When your doses exceed 4 grams per day, the liver's stores of a neutralizing molecule called glutathione become completely depleted. Step 3 is where the real danger hits. A toxic intermediate compound called NAPQI begins to build up and accumulate. And finally, that toxic NAPQI reaches the kidneys and causes direct tubular damage. Oh, and it is absolutely vital to note that alcohol narrows the safety margin significantly. Taking acetaminophen after having a few drinks severely reduces your liver's ability to neutralize that toxin, which just massively increases the burden.
And honestly, the absolute biggest risk here isn't just taking too many plain acetaminophen pills from a single bottle. It's hidden acetaminophen. It's tucked away in NyQuil, Dayquil, Theraflu, various sleep aids, and allergy formulas. It's literally everywhere. During cold and flu season, it is incredibly easy to unknowingly exceed that daily 4-gram safety threshold just by taking totally normal doses of multiple different over-the-counter products just trying to get through a bad cold.
Finally, Section 6, how to protect your filters. Okay, so we've covered the mechanics and some pretty scary dangers. Now let's bring the tension down and talk about solutions, because you actually have immense power to mitigate these risks. I really want you to internalize this quote right here. The kidneys are not dramatic. They do not announce distress. They work quietly and they decline quietly. The damage doesn't produce some urgent flashing pain signal to interrupt your day. They just compensate and compensate and compensate, right up until a meaningful amount of irreversible damage has occurred. Because of this totally silent nature, we have to be proactive, not reactive.
So the crucial point here is implementing these 3 highly protective daily habits. First off, drink a full glass of water with every single dose. Dehydration significantly amplifies the risk of NSAID-associated kidney injury, so volume is key. Second, whenever it's possible, say for an aching knee or a sore hand, use topical applications instead of oral pills. Absorbing the medicine through the skin places far, far less systemic burden on your vital kidney filters. And third, and definitely most importantly, ask your doctor for your specific eGFR score.
I'm going to leave you with this final, vital question. Do you know your current eGFR score? Remember, just because a medication is sitting pretty on a shelf next to the toothpaste does not make it 100% risk-free. Be your own best health advocate. Write this question down, take it with you to your next doctor's appointment, and trigger a specific conversation about your individual risk, not just the average risk. Small daily habits lead to big health outcomes. So, take care of your kidneys, protect your filters, and stay informed.